Hello, hello, everyone. Really excited to see that you're all here to attend this awesome webinar that we're hosting at VoiceCare AI. I'm going to give it just a few minutes to let some people hop in here, and then I'm going to do a quick introduction with Dr. Radfar here, and then I will give him the floor. So hang in there just for a few minutes, and then we're going to go ahead and kick things off.
This one's going to be a good one, people.
Yeah, if you have not implemented sleep apnea in your practice yet, talking with Dr. Adfar really makes you realize um, how much help we can help our patients, right? Just from this aspect. And one thing that was inspiring to me is it's not only adult patients. We often think of adults when we think of snoring and sleep apnea, but it's also children, right? And catching it early. And that's one thing I've learned from attending some of his sessions. So really excited here to host Dr. Radfar. As a quick housekeeping items, this session will be recorded, so we will be sending it out to the attendees afterwards. I am going to have a couple polling questions throughout, so would love your participation in that aspect. And yeah, so Dr. Radfar is better known as Dr. Rad. Rad is actually one of my favorite words that I've been utilizing lately. He's an international speaker on sleep apnea, snoring, low-level laser therapy, marketing, medical billing, and much more. A practicing dentist of 22 years, he has a passion for speaking that includes personal development and strategies that help anyone manifest the life of their dreams. He is the winner of Dentistry's Got Talent at Dykema and the Best Facebook and Instagram Influencer Award. Dr. Rad humbly captivates any audience he speaks to, and I have personally got to see him speak at CDA, and he is quite the powerhouse. So, Dr. Radfar, I'm going to go ahead and hand it over to you. You feel free to take the floor.
Thank you, Amber, for that nice intro that I wrote for you. I appreciate that. And, VoiceCare AI for hosting this webinar. And thanks for everyone for coming on. I do want to talk about sleep today and how important it is to incorporate this in our practice. But most importantly, I also want to talk about AI and how I'm able to use AI for marketing purposes and for things like insurance verification, claim status, prescriptions, all that. So towards the end of the webinar, we're going to go ahead and go over how we can use AI to our benefit so that we can go ahead and learn how to post more, create content, and all these things that we're learning now that, I remember the days where we used to use the yellow pages, right? Some of you guys are old enough that we used to use white and yellow pages. And then pay-per-click came about with Ask Jeeves and Alta Vista and Overture in the late 90s and early 2000 to be able to market. It became Google, and the pay-per-click became relatively expensive. And now we're looking at something called searching with AI and all the different AI platforms. So we do want to optimize ourselves for when we want to get sleep patients or even any dental patient to be able to be found or searched on AI. And I had a patient recently that found me on chat. He said that he entered in his phone, "I'm having jaw pain with popping and clicking and headaches. And I'm looking for a TMJ specialist. I live in Thousand Oaks, California." Well, lo and behold, he found me because that's what popped up. And so I'm going to go over how I popped up and how I figured out with the algorithm through really, guys, I'm talking hours and hours and hours of YouTube content that I've absorbed with marketing, going to hours of conferences on marketing to be able to understand what is it that us little dentists need to be able to do, to be able to optimize, to have our patients see what we do so that we can help them ultimately with the type of care that they need. I'm going to go ahead and pull up my slide here, presentation. So a little bit, about me. I went to SC. It's almost 23 years now. Practices in Thousand Oaks and Oxnard, California. Yeah, I've got some Instagram and Facebook stuff that I've won awards on. Those are my handles if you guys want to follow me, at Dr. Rad Health. And then I have some products under the Rad Health brand, supplements for TMJ, for sleep. I have a spray bottle called Rad Fresh for cleaning night guards and dentures and retainers, and more importantly, sleep appliances, the stuff that we're going to be talking about tonight. So check it out, Rad Health Inc. That's my company that I created during COVID because we're all kind of sitting around for a little bit if we weren't in the dental practice. I'm going to give you a little story. I'm very proud of my accident in a weird way. I don't play victim to it, but in 2009, I fell asleep at the wheel. I crashed my car into a tree, going about 40 miles an hour. I was feeling more tired throughout the day, classic signs. I do have a high arched palate. That was one of the indications that if you, who are trained in sleep apnea, and you were my dentist, you could look in my mouth and back in 2009 and be like, hey, Dar, you sleep okay? Anyone tell you that you snore? You feel tired throughout the day? We're going to go over some of these red flags in the dental chair that we're able to see that we can bring up these conversations or questions with our patients, right? So after my accident, luckily I wasn't even injured or bruised or anything like that. It was a shock that no one believed me that I was driving the car. But it was a sign, it's a positive sign. Again, I don't play victim to it. Since then, I became patient zero. They gave me a home sleep study and a CPAP machine, and I gave it back right away. I couldn't wear it. And then I discovered that there's a appliance in 2010 that can reposition the mandible. I ended up becoming the first patient in my practice. And I ended up getting deviated septum surgery and turbinates cleaned out in 2014 because I couldn't breathe through my nose. And lo and behold, my son, a few months after my car accident, was snoring at 2.5 years old. He was snoring. He was grumpy in the morning. Amber mentioned earlier about pediatric apnea. We were talking about that. And, it's important for us to be able to see this in children too, whether it's our own children or family members, but also if we do see kids, even young adults, teenagers, you'll be able to see some tail signs of sleep apnea, and it's important to know what to do. My son at 2.5 years old had, I call it voluntary surgery, but it's really not voluntary when the pediatric ENT looked at his adenoids and his tonsils. And she's like, yeah, we got to do surgery right away. He's not breathing well. And so, it affected his growth percentile. It was at 30th percentile in growth. He ended up at 70th in about 1 year. So these are the kinds of things that are, powerful because we look in the mouth, we can tell if we can find those and see those red flags and know what they are, we can tell if a patient or a person's not breathing well. So why is sleep so important? If you go ahead and Google how many years off your life if you're left untreated for sleep apnea, the majority of the time you'll see 12 to 15 years off your life. That's a lot. The University of Wisconsin showed 5 times higher risk of cancer of any kind. And I want to talk about that. I after you turn the tender age of 45, and I'm 48 now, there's something that's recommended by the physicians called a colonoscopy, right? For your 45 and over people, hopefully you've gone through it and you've done it because it is a highly recommended procedure. 1 out of 23 people in the United States end up with colon cancer. So, you end up drinking this liquid and doing this thing for prep for about 24 to 48 hours. And then you voluntarily show up to the doctor's office. They put you under and, they go up there and they make sure you're okay. And then you wake up and you go home and you finally can eat properly and all that good stuff. And that's by choice, right? To see if you have colon cancer. There is no guideline or recommendation to have a home sleep study for over 45. And yet, untreated sleep apnea, which a lot of patients over 45 years old have, 30% of the US population has sleep apnea, and close to 80% of those 30% have not been diagnosed, let alone most of them that have been diagnosed can't even tolerate wearing the CPAP machine. So this is the power that we have to help not only get them screened and get them diagnosed, but also to treat them. And so this is very important that we understand that it's not just the 5 times higher cancer risk. We need to make this an industry standard And it's my duty, my passion, based on my personal experiences and the over 4,000 sleep appliances that I've made since 2010 when I was patient number one in my practice. I see it all, guys. I see the depression, the anxiety get improve. Let's be adults here. I've even seen things like frequent nighttime urination, going to the bathroom improve, erectile dysfunction. Who would have thought as a dentist, providing more blood flow because you're breathing well at night can improve your sex life, let alone things like sleep divorce. That's one of the things I have on here. It's a concept that we'll discuss later, that people are just sleeping in different bedrooms and they're in a relationship or they're married. And we talked about the mental health issues like depression and anxiety. It's estimated that up to 48% of depressed patients have sleep apnea. And I've had patients tell me, how can you be this positive, manifesting, everything's hunky-dory and beautiful in life, I'm journaling, I'm meditating, yet if you sleep like crap, or if you get 5 to 6 hours of interrupted sleep and not breathing well, you can't produce serotonin, you can't properly become the happy-go-lucky positive mindset the next day, especially when we're showing up to the dental practice and we've got the internet out. The person's case hasn't arrived and the patient's showing up in an hour. So-and-so called in sick early in the morning, and so on, which is, about 10% of our day is firefighting, and another 90% of our day is doing beautiful things. And really, we need to be in a good mindset. And a lot of people can't be in that mindset if they haven't slept well. So imagine how they're dealing with focus and energy at work. So they have poor work habits, their energy levels are down. So sleep, it is such an impact in not only your health, clearly in your wealth, if your work habits are affected and you're not speaking well and you don't have the proper patience and mindset to be sharp when it comes to business skills, and of course the relationships that it can affect. So health, wealth, and relationships, 1, 2, 3 punch with sleep. Sometimes when I don't even look at the patient's mouth, I can look in a medical history, and your medical history may have this, the ones that are listening to this. What are some of the comorbidities? If 30% of the population has sleep apnea, can we look at the medical history and see if there's anything connected with OSA, or obstructive sleep apnea? So some of the comorbidities is when a patient's tired throughout the day. That's actually a comorbidity if you're not sleeping well. Being overweight. The typical poster child for sleep apnea is someone who has a 17.5 inch or bigger neck for a male and 14.5-inch neck for a female. And sure, obesity can be a red flag, but I was 165 pounds and I'm almost 6 foot tall back in 2009, and I had my accident. So don't judge a book by its cover. It's not necessarily, but it could lead not only to obesity if you have sleep apnea, because you don't have leptin, which is a hormone that, let's say, if we could bottle leptin, you guys, we could be multi-billionaires. Leptin is produced in deep sleep, which is missing in sleep apnea patients. And leptin increases your metabolism at rest and also helps you not crave the fattening, carb-filled foods that we all crave, especially after a night of not sleeping well. If you don't sleep well, the next day you don't really crave having a chicken salad. You crave pizza, you crave hamburgers and French fries, and that's because you're not having any leptin production because you didn't get enough deep sleep, which is when leptin is produced. And of course, the mood and the short-term memory loss issues, these are all comorbidities of lack of sleep. And of course, the most important thing that people worry about when I talk to my patients is snoring. So people can say, oh, I don't have sleep apnea, but I do snore like crazy and I bother my wife because of it. So I always ask my patients, how well do you sleep at night? Has anyone told you that you snore? I don't ask them, do you think you have sleep apnea? Sleep apnea is a medical diagnosis. You don't know, I don't know, even if I've looked at 4,000 plus mouths, I can kind of tell because I've seen so much of the, let's call it, relations in the mouth compared to red flags compared to positive studies. But you really need a sleep test at home or in the lab to be able to diagnose someone. But snoring is something that you don't need a test for. And a lot of people can use an app nowadays called Snore Lab, SNORELAB. It's a free app that you can download if you don't have a bed partner. Listen to your snoring. I advise my patients. So I think I snore. I'm like, hey, you know what? Record yourself tonight. This is the app. Download it. And if you hear problems, give me a call. And when they hear themselves and the way they kind of gasp and whatnot, they end up either calling you or they sometimes frantically and be like, you know what, Dr. Rad was right. I need to figure this out. How can I get a home sleep study? So snoring is a red flag. Impaired cognition or short-term memory loss. We talked about depression and anxiety, and really just feeling less energy throughout the day. The energy that we require to go to the gym, for our loved ones, the energy to be able to be a good partner in life. All these things are super important, and it's all goes downhill with patients with sleep apnea. The biggest problem I see is the effects on the heart, high blood pressure, stroke, congestive heart failure, heart attack, AFib, arrhythmias. I had arrhythmias, and I also had AFib back in the late 2000, early 2010 era. And I had no idea it was correlated to my heart rate fluctuating, because it's got to beat fast a little bit when I'm having an apneic fit, and then it beats slow again. So I lost my rhythm, and that's what arrhythmias are. I was on beta blockers in 2009. And of course, the accident had to, push me towards getting a sleep study. And I'm blessed. I always count my blessings. I'm so grateful that I didn't hit someone or another car. And I was literally a block and a half away in my gated community in Calabasas, California. And how embarrassing, how devastating, how life-changing could that been towards the negative if I did hit someone and injured them. So, these are the kinds of things that when you now look at a medical history, we see high blood pressure with patients. What do we usually do? We all usually say, oh, well, okay, let's put the blood pressure cuff on them before we do a procedure, right? That's what we're supposed to do. Or put a red sticker on the chart, whether it's electronic or paper chart, because we have to be careful with the epi that we use in our anesthetics. All these, we've seen patients walk in, and these are comorbidities. These are associated with patients with sleep apnea. And we're going to talk about what the prevalence is, or the percentages of these comorbidities associated with sleep apnea, in just a minute. We talked about depression and anxiety. Type 2 diabetes is another thing that is linked with sleep apnea. The insulin resistance gets worse for patients who don't sleep well. And then nocturia, getting up to go pee in the middle of the night. Nocturia is frequent nighttime urination. That's annoying, right? It could wake up your bed partner. It wakes you up once, twice, 3 times in the middle of the night. And, when I bring that up, I get John, who's 68 years old. Well, doc, it's because I'm getting old and my prostate's the size of a grapefruit. I'm like, yeah, okay. I understand prostate as we get older for men can cause frequent nighttime urination, but so does that excited, kind of freaked out feeling. It produces more urine. I call it a cavewoman response. When you're excited and frightened, like a kid that gets excited and pees in his pants, that's what happens in the middle of the night. I've had patients literally the first week of wearing their appliance be like, wow, doc, I didn't wake up, or I used to wake up 2 times, now I only wake up once. Boom, jackpot, we're winning. So nocturia is a big one. And then acid reflux, GERD. When patients are taking those deep breaths because they're gasping, the diaphragm, the acid's being pushed up while they're supine or flat, laying flat. That's going to destroy the esophageal sphincter that they have, so they get more reflux. And then how does this show up in dentistry? You got perio because of type 2 diabetes, and you got acid reflux with enamel being worn down, dentin being exposed, class 5 lesions, your composites keep popping off. Sure, they could be drinking 2 sodas a day, a sugar-free, I only drink sugar-free Red Bull. Yeah, it's the acidity, sweetheart. It's not the actual sugar per se that's affecting and melting my class 5 composites that you think that I didn't do it well enough. And you're etching it for a minute and you're bonding it, and this, that, and these things keep popping off because they're grinding their teeth. They have possible acid reflux. So with these patients, simple question. These are my red flags. How well do you sleep at night? Do you feel tired throughout the day? Anyone tell you that you snore? And if you get a yes to any of these, ask them, have you ever had a home sleep study? Notice that I said home sleep study. So I'm removing their barrier or their limiting belief that they can't do one because they're assuming that they have to go sleep in a lab, in a clinic, somewhere else. They don't have time, let alone they don't sleep well at home. Are they going to go sleep well at some random location with a bunch of probes on them? So when they tell me no, I let them know that I have the opportunity to provide them through a company that I use. They're called the Sleep Apnea Team, by the way, in Southern California. And all these things I'm telling you, later on, I'll have my information. You guys can reach out to me and ask me. I'll send you the info. So we can have them send the home sleep study to them. I stay back. I wait for the results to come in, signed by a board-certified sleep physician, letting me know, yes, they have sleep apnea, how bad is it, and how we can treat it. So there is a really easy solution, and these patients are desperate for it. Now they're even asking for oral appliances because they've maybe gone through the process and they couldn't tolerate their CPAP. So it's estimated about 30% of high blood pressure patients is associated with sleep disordered breathing. Heart attack patients, stroke. Guys, if anyone has a stroke on their medical history, you better believe they have sleep apnea. It's 92%. 48% of diabetics, type 2 diabetics, obesity, 90% of obese males, 50% of obese females, and acid reflux, what we just talked about, 60% of patients who have acid reflux have sleep apnea. You fix the apnea, you're going to reduce all these kinds of conditions. I've had patients get off of high blood pressure medication. Please let me know one thing in dentistry that you do that can get you off of medications, let alone lower the risks of all these prevalences that we talk about. And mind you, guys, I still place implants. I'm a dentist that does, crowns. We do about 20 to 30 crowns. I mill in my office. So 35% of my collections or my practice is sleep apnea. So I'm like you guys. I do it all. And adding sleep has just been such a reward, especially this thing called sleep divorce. And we talked about this a little earlier. But some people don't give a hoot about, oh, it could give me cancer. Everything can give me cancer. Everything can kill me. Everything can give me high blood pressure, all this stuff. But they do care about sleeping next to someone and how embarrassing that is, especially if they're single and or recently divorced via contract. And now they're dating and their wife or husband used to tolerate their snoring, or they had sleep divorce where they're sleeping in separate bedrooms. And now they're embarrassingly becoming intimate and not either staying over. And these are the stories that I hear because they're embarrassed if they stay over that the person's going to be like, what was that last night? I didn't sleep well. Or they do sleep over and they get, the problems that happen from that, which is very embarrassing the next day. And usually they don't ask for the person to come back. So this is a real serious issue that people have when they snore. So you could really truly help them, because imagine going on a date and taking the CPAP machine with you. Not going to work, right? You just can't do that. And mind you, when you put that on after your first time you're intimate with someone, they're going to look at you and be like, whoa, this isn't something that I signed up for. So it's not only for people who are already in a relationship, but it's also for people who are interested or about to get into one. So a third of couples who sleep in who are under the same roof sleep in different rooms. So imagine that, a third of relationships that snore, they sleep in different rooms. So, and this is obviously getting a little worse over time. And this is something that we need to pay attention to, because this is part of our marketing. This is part of what we need to post on social media. The prompts that we put in chat, which we're going to go over in the second half here, need to address the questions that people are saying or speaking into their phone or typing into chat that they need solved for. I want to show you guys just a few things to look for, some red flags. One of the biggest ones is large scallop tongue. If the tongue is really big and it looks kind of scallopy, I have a picture of it, these little ridges, that means they're tongue thrusting in the middle of the night. They're causing these indentations as it hits the lingual embrasures of these teeth, the back of their teeth. Classic. If you're about to prep and you're nicking the tongue on number 14 or 3 or 15 and the tongue's in the way, once you're done with your prep, call a little timeout, let John know that he did great, and Ask him, how well do you sleep at night? Because when I had you back, don't tell him that you think this tongue is the size of Montana and how do you get your tongue so big? Where did that come from? None of that, right? In all seriousness, I just asked them, when I had you back, I'm just curious, how well do you sleep at night? Look like your airway is a little restricted. And I'm concerned you're not getting enough air. Have you ever had a sleep study? Do you feel tired throughout the day? No, doc, everything's great. I sleep like a baby. I don't know what you're talking about. Great, no problem. I'll see you in a couple of weeks for the delivery, or I'll see you next time at your next check appointment. By the way, if you have any friends or family that don't sleep well, they snore, or they get tired throughout the day, we help with that now. Have a good day, John. And you plant the seed, just like you plant the seed for anything else that we do in dentistry. Let them know you do this. They may have a friend, a brother-in-law, a boss, a coworker, somebody that's been complaining about this. And now that you do this, it's a really good idea for them to know. Bruxism, lower anterior wear, pits on the molars. Pretty classic, right? We've seen this, and what do we usually do? A all porcelain crown, or we put a little etch and put some composite, flowable composite, or into these pits? Or how about this lower anterior wear, or these class 5 lesions? Oh, okay. Why is this happening? Is it just because they're stressed out about everything in life? Sure, there could be a possibility of that, but it's estimated. Again, ChatGPT, Dr. Google, Dr. Rad, about 53% of patients who have bruxism is because of the apnea. So we can't just treat a patient for bruxism anymore. We have to address the sleep and the airway first. And if they're telling you, no, I sleep great, then you can possibly go and make them a night guard. But if they have any sleep issues, advise them that this could be bigger than just grinding your teeth, and the grinding can improve if they're not struggling in that fight or flight response for air. And again, what my favorite appliance for patients who really grind badly is the Sleep Herbst appliance. And then, of course, there's tonsils that we can look at, the tonsil size, the retreated mandible, if they're class 2, 3 millimeters or more molar class 2, from ortho class back in the 100 years ago when I took that class. Or if they have very narrow arches, the intermolar distance is less than 36 millimeters on the top between the lingual cusps. These are the kinds of things that we need to pay attention to, because the tongue doesn't have a place to sit. So when you have narrow arches or longer faces, there's likelihood, and usually those people are a little skinnier, there's likelihood that there's no room for the tongue, so it falls back and hits the soft palate. So what are the treatment options, right? There's CPAP, there's oral appliance, there's surgery, there's supplements and medications that people can take, and there's sleep hygiene. I wanted to go over the supplements. There is an ingredient called N-acetylcysteine, or NAC. I actually put that in my sleep supplement called RADZZZ. If you Google NAC, NAC, and sleep apnea, you'll see the first thing is an NIH.gov study that showed 30% reduction in apnea hypopnea index, which is the score, the sleep score that you get when you do a sleep study, just by the use of NAC. I believe they used 1,000 milligrams an hour before bedtime. So that's a little trick for you all. If you want to get breathe a little better, it acts as a natural expectorant for your airway. So therefore you don't get as much of a tightening of the back of the throat. It relieves the mucus back there that we all build up so that more air can go in. And that's the mechanism. So there's supplements out there that can not only calm the mind: melatonin, valerian root, L-theanine, magnesium glycinate. These are my favorite ones that I put in my sleep supplement, but NAC is one of the biggest ones to help with sleep apnea. So now let's talk about AI, right? There's a lot going on with it. Every 2 seconds, we're all hearing about it, right? And so you could use AI to actually give you prompts, or captions and hashtags for any post that you want to do. You could basically speak into it. And I spoke into my phone the first time I did it. I said, I'm a patient in Thousand Oaks, California. I have TMJ pain and issues. I have a hard time opening my jaw, and I have headaches, and it's hard for me to chew gum. So those are the words that need to go into your captions when you do a post on Instagram or Facebook. Those are the exact words that I say. Create me an Instagram and Facebook post with 10 hashtags that are optimized for the algorithm about my practice, 805 Dentistry in Thousand Oaks, California, and how I can help patients who have jaw pain, headaches in the morning, they have pain when they're chewing gum, and their jaw feels tight. So all the things that people are searching, you put in the prompt in Chat GPT, it'll create that for you so that when it is posted, guess what Chat looks at? It looks at posts on social media that match the words that people are speaking into. Now, if you have no idea what your patients are requesting or searching for, I mean, you're not paying attention to what they're telling you in the operatory. That's okay. Ask Chat, what are patients searching for with TMJ issues in California or in my area? And even Chat will give you the prompt that they're searching for. And that's one tool to use AI to be able to create your captions and whatnot. The other one is the hashtags. You want the hashtags to match also the stuff that they're typing into Chat or they're speaking into their phone or Google, because there's so many different AI platforms. They're all taking this from social media. The other big one that they're taking it from is your blogs. So I use doc sites for my website, and every week we post 2 blogs. ChatGPT writes the blogs for me. It's a Q&A format of the blogs. And I think I have let me see if I have yeah. The blogging with AI is huge. The blogging, I asked Chat, give me 10 Q&As that people are searching for and need questions answered to when they have TMJ or jaw issues. So it gives me all those answers. I take that blog, I send it to doc sites. They post it as a blog on my website under my blog section. AI, Chat, whether it's ChatGPT or Gemini or Perplexity, whoever it is, will go grab this from websites and from social media. So if you have these words on your social media, you have these Q&As on your website, you're more likely to be put in the Chat recommendation or in the AI recommendation. And even better, especially if you bonded with one of your patients and you can have them do a review, have them try to put something about these search terms, especially if it's a buddy of yours or it's a family member, somebody, post one review at least in Google with the words that we're talking about that's optimized for AI search in the review, so it picks it up from Google reviews as well. And that's how you optimize yourself for your area. Now, VoiceCare AI is a different format. We got the marketing that we just talked about. And then we've got all these patients coming in and they want to use their insurance. They want to use dental insurance. They want to use medical insurance. And in my office, we do medical insurance for sleep. And some of you who are doing sleep or may be interested in doing medical billing, my whole coaching program incorporates not only the home sleep testing, but the medical billing company. All the pain points are done for you. And this company does a beautiful job in lowering your, let's call it, need for your front office to be able to go and run it and figure out eligibility, claim status, and all these things, managing prescriptions, tracking your claims, handling pre-authorizations, which are required for sleep apnea appliances. So VoiceCare AI has really helped, let's call it, reduce the amount of time that I pay my front office to do this work at fractions of what they would, not to mention it's frustrating for them. So when VoiceCare AI does it for me or for any of the offices that work under my coaching program, how that benefits them is now their front office is just focusing more on patient care and all the other things we need to deal with outside of the insurance world. They also do a lot of automations, right? Because automations also save you time. They provide the workflows that you need to be able to have more of an accurate, consistent flow. Human error is, I've got the best treatment coordinator out there, an insurance biller, and I can tell you she makes at least one mistake a day that I catch. And these are the types of things that now we have the proper automation under VoiceCare AI. And I believe Amber If you guys ever were interested, you could talk to her directly. She'll help you with getting with your practice to do an analyzation and see if you guys are a good fit. It's estimated that AI will reduce your workforce by about 70%. You know, when I look at my staff and I see them doing other things besides calling on insurance to get benefit breakdown, and an AI can do that, you know how tedious that is, right? You got to speak to someone. That person, you know, he may give you the wrong information. You may have to call back, and then someone's walking in, someone's checking out. It's tedious, and it's so much better to have a system that's done for you than having your front office do it like the old school way. Let's not do it the yellow pages way anymore, guys. Let's do it the AI way. So what's next? You know, I always do this because for me, personal development has become one of the biggest important things in my life. I've worked under Tony Robbins, Dr. Joe Dispenza for meditations. I've worked under Kabbalah. I've done work with Danny Morell, Peter Crone, the mind architect. And I realized something. Between all these people, there's one thing I realized: taking action. Taking action, sitting in the place of no action is way more miserable than taking action and failing, or taking action and winning, right? Even if you want to win the lottery, you got to go to the store and buy a lottery ticket. You can't just sit there and wait for it to happen. The living in fear has become such a problem for us because we've failed so many times in our careers with things that we've tried. So we have evidence that that fear is going to trickle down into other things that we do. But keep in mind, you've done so many beautiful things in your life. You've gone through 4 years of college. Most of you have done 4 years of dental school. You've created these practices. You're either an associate, you're working hard. You've learned so many different, you've put shots in people's faces, for crying out loud, and get them numb to do the work. Crown preps with 0.5 millimeter margins that you were graded on. This kind of action to do sleep is a no-brainer. You just need the proper system in place. So I'm available for you to be able to give you a full training program that is a full day's worth of information. Everything that's done for you, the home sleep testing, the medical billing, the staff being trained. You don't have to hire new people. You don't have to change your whole practice around. It's lead with your heart. Do what you're supposed to do, which is look in the mouth, look for disease, including sleep apnea, which we're licensed to screen for. Send it off for a home sleep study. Let them do it for you. Get the results, go over it with the patient, save lives, save relationships, improve their mindset, and really make a difference, guys. This is really important stuff. You know, we're not just dentists anymore. We're real doctors. And I appreciate VoiceCare AI for having me on. I appreciate you guys coming on. And I'll open it up for any questions that you all may have. And this is my information. You want to book a call, just scan the QR code. We can chat together on a Zoom. I can show you everything. That's my cell. Please text me and let me know how incredible I am. Wink, wink. But no, seriously, I'd love to know you all. Text me. Let me know who you are, where you're from. I love creating relationships and connections. I speak at a lot of different conferences. People come up to me and, you know, high five me, give me a hug, let me know that, hey, now they've treated their dad or themselves or their husbands or wives or their own kid. I mean, how emotional is it to be able to figure out your own kid has apnea and change their path because of the stuff that you learned through my program or through any sleep program. Thanks for having me on, everyone, and I'll open it up for questions.
Dr. Radfar, that was absolutely incredible. I know it's really hard to cram all of this into a 30-minute session. I know you have a lot of material, so we do have some questions in here. I'm just going to go ahead and ask them, and you can address them directly. One of them said, how can we do an analysis of sleep apnea without proper sleep testing?
So it's like saying, how could we analyze high blood pressure without putting the blood pressure cuff on, right? So proper diagnosis has to be done through a home sleep study or a lab one. But the red flags or the assessment to lead to the recommendation of that are the stuff that we discussed with respect to the medical and the dental comorbidities: high blood pressure, acid reflux, medications for depression, class 2 jaw, large scallop tongue, lower anterior wear, class 5 lesions, type 2 diabetes, history of cancer. Guys, when you see someone come in with a beanie on because they've lost their hair because of chemo, we think one thing: no x-rays today, even if they're due, right? Because they're going through a lot of chemo radiation already. Also, because we know that the 5 times higher risk of cancer of any kind, ask them how well they sleep at night. I know it's crazy. Oncologists should automatically require home sleep studies for every cancer patient that's diagnosed. They focus on cancer. I've had this quote unquote argument with physicians. They focus on their specialty. So they're not focused on what the underlying cause is. Is it diet? Is it genetics? Is it that? They're focusing on how to treat the patient when they get the patient. So, but we can see it. If we see these tail signs, we see these red flags, refer it, at least bring up the conversation and have them go to a physician, a sleep physician in the neighborhood, find one, Google one in your area, get their business cards, at least refer them if you're not going to do this at your office. But ultimately, you're the only person who can make the oral appliance, and the CPAP is 70% untolerated. So you got all these patients that are going to need some sort of therapy, and you're the only one as a dentist that can do it.
Got it. And we also have a quick chat in here. I'll address that and we'll move to some of the other questions in the panel. What at-home study units are you using? Thoughts on take-home disposable like ResMed Night Owl?
Yeah, I love the Night Owl because you can do multiple nights, and the sleep apnea team sends the Night Owl. I hate WatchPad because they only can do one night, and one night can't give you what you're supposed to give. I tell my patients, you're going to do it for a few nights, 2 or 3 nights, and that can, when they download the app, the Night Owl, the sleep apnea team can see if they've got enough hours. If they don't have enough hours, they'll call the patient and be like, you need to do a 4th night. You took it off in the middle of the night. So the Night Owl is one of my favorite ones. It's easy to wear on your hand. And I advise my patients, I go, do you drink alcohol? Yeah, doc, I have a glass of wine every night. Don't be goody two-shoes. Drink alcohol. Smoke that weed that you smoke every night. Take your melatonin. Do your normal Wednesday night, do your normal Saturday night. So we have a mix of nights for the sleep study so you can get an accurate diagnosis. Because if you're being perfectly good at two shoes with no depressants such as alcohol or dry mouth and like marijuana gummies and stuff like that that people take, these are the things that we want them to take so we can get the worst case scenario along with a night that they don't do these so we can get an average. And the Night Owl is my favorite one.
I like getting the worst case scenario there. All right, I'm going to move over to a question. We'll hop over to your chat questions soon, Joshua. Let's go ahead and address my associates don't want to do more. How do I get them to be open to offering this in our group?
So, they don't want to do more what? They don't want to add 6 figures to their practice or do more into their collections. I mean, we're getting an average of $2,500 to $3,500 in appliance. That's the average cash fee, and medical insurances can range from $1,500 for Medicare up to $9,500 for PPO. There's a money motivating factor. The other factors are saving lives. Literally, you're saving lives and relationships. And the biggest part here is patients are coming to me from your practices, guys. They're coming to me from dental practices because they see me doing it and advertising it in the community through chat and through social media. And guess what? 18% of my patients that are coming from other dental offices are turning and becoming my patients. And I'm not stealing them. They're just looking at me and going, you're doing this, my guy's not. So you're going to lose patients. And because of the awareness that's happening here. So my advice is if someone's not interested, they're not interested. Not everyone places implants. Not everyone does clear aligners. That's okay. It's something that maybe doesn't move you. But at a minimum, I would have them, come to a webinar like this, share with them maybe the recording of this, and see if there's something that triggers. You may think they're not, but when they hear something, my dad went through this, my uncle this, my brother-in-law this, they may trigger an emotional response that they're going to be like, yeah, you know what? This isn't that hard to do. I can learn it. It's usually a fear of failing and not knowing how to do this. And I've created a system without any arrogance, guys. It's the best system out there because the more I can help you do this, the more humans I can help not crash into a tree or into a human or have these other medical comorbidities. I can't do it all myself. I need you all to be parts of me together so we can do it together and help more patients.
Yeah, I couldn't agree with you more on that. I mean, I think it's about prevention, right? We can prevent accidents like running into trees from happening seriously, right?
And
So good
4% of
answers
all
on that.
accidents, Amber, 4%. That's enough. These truck drivers are running into people on the freeway or into the middle center divider. I guarantee you there's at least one person here who's fallen asleep at the wheel because they were quote unquote tired. Bring it up to your patients. Send an email. I have in my internal network marketing emails that I provide my clients. There's 12 emails that we send every 2 weeks. An email. One of them is a story about a person who's fallen asleep at the wheel. And if that's something that you've had and done, come to my office. Let's evaluate you for sleep apnea. And boom, literally, when we send that out, there's like 5 or 6 people who call for a consultation for sleep because they now are aware that Dr. So and so is their dentist is doing that because we're sending these emails free to send these emails out and making that awareness.
Nice. You already answered another question that was automatically in the chat about really patient education and driving awareness. So that was good. A two punch on that one. We got a question about where you're getting your appliances. Thoughts on the Vivos curriculum and appliances?
Uh, I'll tell you what I like, and then the rest you could assume. I'm a big believer in 2 appliances. The Sleep Herbst, it's been the gold standard and the one that is the most durable. I've worn one for 9 years before it gave way, and the other one's been almost 6 years. I also have an Airvada. Dr. Michael Gelb and Lane Martin created the Airvada is non-metal hinges. It's very sleek. Those are my 2 favorite appliances for clenchers, grinders, sleep apnea, obviously, and snoring patients. I use Gergen OrthoLab for the Sleep Herbst. Airvada has their own lab, and you guys can reach out to me, and I can connect you with both labs. If you already know how to do this and you just want connections to the lab, let me know, and I can direct you.
Yeah, and maybe you can give me that information afterwards, and I can include it in our follow-up email for our attendees today, just so they have a resource on that piece. Um, and then we do have another question here. When do you decide whether you want to treat in office or refer out?
To treat the sleep apnea patient, I'm assuming that you're wondering if you should do a CPAP or an oral appliance. And so that's the discussion because the sleep study will say CPAP, oral appliance for surgery for anyone with the mildest sleep apnea or the most severe apnea. That's what you get from the home sleep testing company by Dr. Singh, the board certified sleep physician, when you send in a sleep study. So patients with AHI under 30, which means mild and moderate patients, are more successful with an oral appliance than ones that are over 30. I have a case that I literally just did. I posted it on social media. AHI 34.2, we brought him down to 2.4 in three titrations or 3 adjustment appointments. So I have taken severe patients to under 5, which is under 5 times an hour. That apnea hypopnea index is healthy. But for the most part, anytime I see a 30 and over, John, I really want you to try to CPAP because I know that'll work for you better. Are you willing to do that? And if they say yes, I refer them to the sleep physician in the area. And guess what? Once a month, I send him a case, and he loves me because he has so many non-compliant CPAP patients. That's how I do 20 to 30 appliances on average a month. It's half of them are MD referrals, and most of it comes from sleep.
That's awesome. We do have a question here that is a little bit more on the AI focus. It says, can you give some specific examples on how you're using how your front office is using AI to automate tasks like an insurance verification?
Maybe Amber, you want to go over that since that's your specialty. You've
Yeah,
seen
yeah.
me
I think
train my
there's
staff.
there's multiple ways to kind of automate insurance verifications. And I do find that people are utilizing portals to kind of get quick access to information. But no matter how you chop it up, there's always payers that you're kind of forced to have to pick up the phone and call, especially if you want a detailed verification. For something like sleep apnea, where we do bill medical, there is some complexities in that. And so I think utilizing something like a VoiceCare AI that can automate the outbound calls to payers and get you really detailed breakdown breakdowns of that treatment, is a really good, easy, automated way to automate insurance verification. Again, there's multiple ways to kind of chop it up. But we always figure, we want to reduce your staff time on the phone, and we also want to give you accurate data. So being able to customize what information you're gathering, and not just being forced to kind of get some of those quick eligibilities or quick verifications that we use for standard GP kind of stuff. On the specialty side, you're probably going to be picking up the phone and calling the payer a lot, and so we can help you automate that. We did include a link in the chat button. Feel free to click on that and schedule a demo if you want to learn a little bit more. One more question and then we'll close it out. It says, have you seen a lot of patients really improve depression from treatment of sleep apnea? And how do you talk about this impact it has for the patients?
Wow. I mean, that's when you work on yourself and you go through therapy, and some of us have done that, you would be surprised how much mental health is not just a buzzword. It's actually people they're struggling to heal. And everyone has some trauma or some issues that they're dealing with from childhood or as an adult, and to have the utmost compassion and understanding, for that. When I see on the medical history that they're taking an antidepressant, or they may not even volunteer that information, maybe they're hiding it, or maybe they're not really diagnosed yet. And to be able to see studies that show up to 42%, I believe it was, of depressed patients as a direct result of the lack of serotonin production because they're not getting deep sleep. I mean, when I have patients that have gone off of medications like Prozac or any antidepressant, and they're in a positive way tearing up in my office that they're feeling like life doesn't suck as much. Guys, I don't care. Again, I do Invisalign, I do veneers. All this stuff is powerful things that we provide. That is on a different level. That's like instant gratification. How can you be in a good mood and have positive thoughts and be happy when you're constantly heart's racing, not breathing enough, not getting enough oxygen, you're tired throughout the day. There's only so much coffee. I drink 4 cups of coffee, so I want to know what kind of whitening we have. Whoa. Hold on a second. Why are you drinking 4 cups of coffee? How well are you sleeping at night? My coffee whitening conversation becomes or my energy drink conversation becomes why are you having poor sleep? Have you been tested with a home sleep study? Notice I use the word home. These are the kinds of things that, that you need to slow down. And we need to talk to our patients. And if you don't feel comfortable in doing it, at least let them know, look, I've seen the correlation between, depression or any sort of not feeling as cheery and happy with sleep issues. And you're telling me you have sleep issues and I see the red flags in the mouth. Here's Dr. So-and-so sleep and down the street. Go get it evaluated by him or her if you're not the type of dentist that wants to touch it.
Yeah, great answer there. I think that this has been such an informative webinar. Thank you all for asking so many questions and being really engaged. That's really awesome. You know how some of these webinars can go. So we will be following up and sending out a recording of this webinar, as well as some of those links that we talked about. So thank you all for joining the VoiceCare AI webinar with Dr. Dar Radfar today. And if you have any follow-up questions, feel free to email myself or Dr. Radfar, and we will get those answered for you. Appreciate your time this evening and hope you all have a great rest of the day.
Stay rad, everyone.
Bye.